Hello everyone, my name is Kazeem Arogundade. I am a medical doctor and also a public health professional. As part of the female genital schistosomiasis subject matter expert training of the FAST package project, I'll be taking you through the first module, which is the overview of schistosomiasis and female genital schistosomiasis. So what are the learning objectives for this module? By the end of this module, participants will be able to describe schistosomiasis, female genital schistosomiasis, as well as the transmission and clinical presentations. Participants will be able to identify the risk factors associated with schistosomiasis and female genital schistosomiasis, and finally recognize why female genital schistosomiasis is a significant public health and sexual and reproductive health issue. So I'll be presenting using this outline. The first part of the presentation will focus on the overview of schistosomiasis, and the second part of the presentation will focus on the overview of female genital schistosomiasis. So what is schistosomiasis? Schistosomiasis is also known as bilharzia or snail fever. It is an important parasitic disease caused by blood flukes, also known as trematodes. The parasitic worms live in freshwater snails. Schistosomiasis has the highest mortality among the neglected tropical diseases recognized by the World Health Organization. One gets infected when the skin comes in contact with contaminated freshwater. Talking about the global burden of schistosomiasis, it affects the health and well-being of almost 240 million people worldwide, and globally 700 million people live in endemic area. Mortality due to schistosoma hematobium infection is estimated to be between 24,000 and 200,000 per year globally. About 90% of the global burden of schistosomiasis is found in sub-Saharan Africa. There are two major forms of schistosomiasis, which are the intestinal schistosomiasis and the urogenital schistosomiasis. Four main species of the blood flukes cause the intestinal schistosomiasis, which affects the gastrointestinal tract, while the urogenital schistosomiasis is caused by Schistosoma hematobium species, which is found in Africa, Middle East, and a part of France. Urogenital schistosomiasis affects the urinary and genital tracts. So talking about the prevalence of schistosomiasis, this map shows the endemicity of schistosomiasis in the African continent. As you can see, countries with high schistosomiasis prevalence, that is schistosomiasis prevalence of equal or greater than 50%, are highlighted in red, and you can see them spread around West Africa, some parts of East Africa, South Africa, and Madagascar. So talking about the risk factors for schistosomiasis and the population at risk. Schistosomiasis mostly affects rural and poor communities, particularly those with fishing and agricultural related activities, or those without access to safe water supply and adequate sanitation services. Certain habits of school-age children, such as swimming, bathing, or fishing in infested water, make them vulnerable to schistosomiasis infection. So how is schistosomiasis transmitted? Transmission occurs when urine or feces containing the parasite eggs from people infected with schistosomiasis gets into the water bodies directly or indirectly. The eggs hatch and release miracidia, which penetrate a suitable intermediate snail host and develop into sporocysts. The sporocyst then develops into sarcaria, which is an infective larvae, which is then released into the snail, which is then released from the snail into the fresh water bodies. After exposure to the freshwater body, the larva of the parasite penetrates the skin and then migrates to the veins around the liver or bladder, where they mature into adult worms. Roughly, it takes about 4 to 6 weeks for the larva to mature into adult worms. The adult worms then get paired, and the adult female worms start to shed eggs as early as 4 weeks after infection. The eggs then travel through the blood vessels to pelvic and urinary organs, where some of the eggs are trapped in the tissue linings, causing inflammatory reactions and damage to organs, while some are shed in urine, semen, or in the vagina or cervix. The eggs can be implanted anywhere along the female genital tract, from the vaginal walls to the cervix, ovaries, uterus, and fallopian tubes. And similarly, in the male genital tract, the eggs can be implanted in the urinary bladder, in the prostate, or around the testis. So what are the symptoms of schistosomiasis? Symptoms of schistosomiasis are due to the body's reaction to the eggs of the blood flukes. When the larval flukes penetrate the skin, it can cause fever and rash. Schistosoma mansoni and japonicum primarily affects the intestine, liver, and spleen, causing liver and spleen enlargement, also known as hepatosplenomegaly. It can also cause abdominal pain and diarrhea. Other acute presentations of schistosomiasis are lymph node swelling, dry cough, headache, joint pain, muscle aches, and pain. For urogenital schistosomiasis, the classical sign is hematuria, which is also known as blood in urine. It can also cause painful urination. Urogenital schistosomiasis could also lead to complications such as kidney damage and fibrosis of the ureter and bladder. And in advanced cases, it can cause bladder cancer. In terms of prevention and control of schistosomiasis, the World Health Organization recommends praziquantel for the treatment of all forms of schistosomiasis. Schistosomiasis can be prevented by avoiding contact with freshwater bodies and having access to safe water, including proper sanitation, including proper sanitation and hygiene. In terms of controlling schistosomiasis, this can be achieved by eliminating the snail and through large-scale preventive chemotherapy with praziquantel. An example is the mass drug administration campaign for school-age children. So, in summary, we have discussed the overview of schistosomiasis, from the meaning of the disease to the population at risk, forms of the disease, prevention, and control. So this slide just shows the summary of what we have covered in the first part of the presentation. So now we are moving to the next part of the presentation, which is the overview of female genital schistosomiasis. So what comes to mind when we hear female genital schistosomiasis? Female genital schistosomiasis is a specific disease entity of urogenital schistosomiasis. Is a gynecological disease and neglected sexual and reproductive health disease. Based on available literature, part of the reason why it is a neglected sexual and reproductive health disease is because urogenital schistosomiasis is usually regarded as a boy's disease. It mimics STI and often misdiagnosed, and there's lack of awareness among community members and healthcare providers. Also, the healthcare providers also lack the capacity to diagnose and manage patients suffering from female genital schistosomiasis. So female genital schistosomiasis is a common complication of untreated schistosoma hematobium infection in the female genital tissues or organs, such as the vaginal walls, cervix, ovaries, uterus, and fallopian tubes. Schistosomiasis in the genital tract dates back as far as 1943 when the first case was noted. In terms of the global burden of female genital schistosomiasis, globally, about 56 million women and girls, mostly in sub-Saharan Africa, suffer from female genital schistosomiasis, and 450 million people are living at risk. This map, the map displayed shows area predominantly affected by schistosoma hematobium infection, and we can see the concentration in West Africa, East Africa, Southern Africa, and in Madagascar. It is estimated that 33 to 75% of women living in communities endemic for schistosomiasis may have FGS following exposure to the parasite in freshwater bodies while conducting daily activities or household chores such as collecting water for the family, washing clothes, swimming, fishing, and so on. Female genital schistosomiasis is caused by an inflammatory reaction to schistosoma eggs trapped in the female genital tract, as I mentioned earlier, and this could occur anywhere along the female genital tract. The inflammatory response in the female genital tract can cause visible lesions such as patches, papules, and abnormal blood vessels. And you will learn more about these in the FGS screening, diagnosis, treatment, and care pathway model. Untreated schistosoma hematobium infection in the female genital tissue or organs of young girls and women can rapidly progress towards swelling or ulceration of the vulva and vagina, causing vaginal bleeding, contact bleeding, pain during sex, and this can also gradually progress towards damage of the reproductive organ, characterized by spontaneous abortion, ectopic pregnancy, infertility. If there is treatment with praziquantel, the adult worms die and are no longer active. So there is no more shedding of new eggs and the symptoms will improve. However, lesions due to existing eggs may not resolve until fresh tissue grows where possible. This slide also shows the various lesions earlier mentioned, the rubbery papules, sandy patches, yellow sandy patches, and abnormal blood vessels. So you learn more about the diagnosis and treatment and care pathway for FGS in the next module, like I mentioned earlier. So diagnosis can be by visual inspection or colposcopy, which may miss some cases. Hence, presumptive diagnosis is recommended, particularly in low resource settings. And in young girls, cervical examinations are not recommended. Based on the evidence available in the literature, female genital schistosomiasis is associated with a 3 to 4 times increased risk of HIV infection. In addition, there is also an association between female genital schistosomiasis and human papillomavirus, the virus implicated in cervical cancer. As mentioned earlier, that the symptoms of FGS are often misdiagnosed as sexually transmitted infections, causing unnecessary investigations, repeated treatments for sexually transmitted infections, which can be expensive. Therefore, women may be falsely accused of sexual promiscuity, leading to stigma and discrimination. Complications of untreated schistosoma hematobium infections of the genital tract can lead to complications such as spontaneous abortion, ectopic pregnancy, and infertility. And these negative impacts on young girls and women put together are more likely to affect the mental health of young girls and women, causing issues such as depression, social isolation, and school absenteeism, particularly in young girls. So this slide describes the cycle of FGS misdiagnosis and treatment. So FGS afflicted woman presents to the local health post A and leaves to receive treatment at the local pharmacy B, where she most likely is treated for STI, which leaves her with the symptoms. And the same cycle may be repeated. So without resolution, the woman may be referred to the next level health center C, where again she is most likely treated for STI and leaves to receive treatment at this local pharmacy B, again without resolution. The woman may then be referred to the next level health center D, where further exams and tests are done. However, she is most likely treated for STI again at the local pharmacy B and does not return to her healthy state. So with an FGS diagnosis at either of the facility A, C, or D, the woman could be treated with praziquantel and returned to a healthy state. FGS being a sexual and reproductive health issue, the stigma associated with it cannot be overemphasized. Imagine school-age girls who are not sexually active but presenting with symptoms such as genital ulcers and discharge that resemble sexually transmitted infections. You will learn more about these in the module dedicated to stigma, social inclusion, and community awareness on FGS. Slides for this module were developed from the Bridges to Development training slides on FGS developed for the FAST package, Countdown Liberia and Nigeria, WHO and CDC. So for additional information on the overview of schistosomiasis and FGS, I encourage you to review the displayed resources. And on a final note, I would like to acknowledge all the FAST package partners displayed on this slide. So thank you everyone for listening, and we look forward to your questions.